Yep, she's getting pretty serious at the moment.
John Edmonds, if I could start with you, if I may. We had a similar program 3 weeks ago, which you were on, and you said at the time that actually, let's listen to what the scientists are saying, but, we don't need a full government lockdown yet, we don't need to lock down the country, and then a few days later, the government decided to do just that.
We've got people that are not speaking, and this guy is one of them. Anyway, urgently and, early and well.
Do you think that the government squandered some precious time that the Chinese had bought us with their own lockdown?
So I think from a purely epidemiological point of view, the best thing for us to do would have been to go into lockdown in January and then stay in lockdown until we get a vaccine.
Same from New Zealand's perspective. So that's the question. Why did we allow many overseas people who we know that were infected? They came in on aeroplane after aeroplane from infected areas, and we knew. And so there was no one in, let's say, 5 million people in New Zealand, but every time a plane landed after we locked it down, and we're still bringing in expats.
Might be a year from now or longer, but that's not the best thing to do for the country. We've been in lockdown now for about 10 days, and it's really starting to drag, I think, on many people.
He's talking about it starting to drag. India's looking like a million people will die. They're at 3,500, and it's doubling every 3 days.
And so you do have to time these sorts of interventions properly, because you have to try and keep people with you. And that is what I was saying in our interview a few weeks ago, and I still maintain it.
I think you said on Wednesday that we're beginning to see this lockdown having a positive effect. Can you tell us more about that?
Yes, it looks like it. And we can compare how many contacts people make now, or are making now, with how many contacts they normally would make if there wasn't an epidemic. And from that we can infer what the reproduction number is likely to be. So this reproduction number is the average number of secondary cases each case generates. And we think it's now below 1, which means that the epidemic should start to peak. So you won't see it until probably next week. You'll start to see an effect. So this is when we think you'll start to see these data starting to peak.
So New Zealand's in a situation similar to Britain. So let's see.
Doesn't mean the epidemic is over, though. It just means that we've stopped it from growing.
Okay, let's bring in Debbie Sridhar. Debbie, and are we now on the right track? The curve is beginning to flatten. Do you agree with that assessment?
Well, I think, what we are hopefully seeing is that people are complying with the physical distancing measures. So what you would expect to see is, of course, a slowdown in transmission and staying within NHS capacity. The worry is that actually we do want to get out of this kind of lockdown situation. It's not good for society. It's not good for the economy to be in the situation we're in. And so what happens when we release the lockdown and we go back to somewhat semi-normality? Is it going to mean that the spread increases again? And I worry that we'll be stuck in an endless cycle of lockdown and release, which is basically going to be dictated by how NHS capacity looks.
Yeah, so those that have got the virus and survived, and this is at a global level, they're able to inhabit in an area and be fine. And so sanatoriums, they were things they had in the old days, which, they used to basically take patients out of society into those zones, and they were the sick ones. So we're in an interesting situation now where we have people that haven't been contacted the disease, but are the most likely, if they did contact it, 1 in 5 may die, that sort of thing. So do we ask them to self-isolate, and then the rest of the community gets on with life? This is what this
what will that kind of lockdown, on again, off again, do to our society?
Oh, I mean, this tears at the social fabric because, I mean, the thing I think about is every day in lockdown, we're having kids who are not in school, not getting an education. You're widening inequalities, so you're having children falling into poverty. We're already seeing a steep rise in the demand on food banks for things like bread and milk and basic necessities. You're seeing, a rise in, calls for domestic abuse. And women needing support, child abuse. I mean, there's all kinds of knock-on social effects.
John Edmonds, I wonder to what extent the government is thinking that there comes a point when the benefits of this lockdown, of these really quite stringent social measures, are going to be outweighed by the negative effects on our society that Debbie has just outlined.
Well, I think they're trying to monitor that all of the time. So there is a balance that needs to be struck here. Between the lockdown, which is the best thing epidemiologically for this virus, and everything else in society. And this sort of very long period of perhaps intermittent lockdowns, that's exactly what's going to happen. That's what we're in. We're maybe 5% through this epidemic so far. So we've got a very, very long way to go.
So if we're 11 days in at 5%, we can multiply that by 20. So 11 days by 20, put a zero, that's 110 days, and double it. That's 220 days. I mean, there's only 365 days in the year. So we're sort of looking past right through winter and, New Year 2021.
David Heyman, you've got a vast amount of experience when it comes to dealing with epidemics like SARS and Ebola. Looking forward then, what's next in all this, do you think?
Well, the next is a good risk assessment by the government, which they'll be doing, and they now have the ability to do antibody testing in communities to determine what really has been the spread of this virus during the period.
Yeah, that's the important thing, because the most important thing is to find out those that have had it and survived it, antibodies.
Preceding months. Information that John, for example, needs in his modeling activities to better understand what is really going on. This is a new organism. We don't know its destiny. We don't even understand completely its transmissibility.
One country that's been mentioned an awful lot is South Korea. This is a democracy, a very proud democracy. It's also a very affluent society. They had a very large number of infections at the beginning, but a relatively small number of deaths. What have they done that others haven't?
Well, South Korea recently, maybe 3 or 4 years ago, as you'll remember, had a major outbreak of MERS coronavirus, of over 300 people infected from this one person who entered. They had a lesson, they learned that lesson, and they prepared for the next one.
Finally, to all three of you, a very brief question with hopefully a brief answer. Where do you think we will be by the end of the summer? David Heyman.
So the end of the summer, so in New Zealand, we've just finished the summer. So what are they talking about is spring. So they're talking 6 months.
Know where we'll be, and I think it would be false to say we do know. What I do know, though, is that other respiratory infections decrease in transmissibility in the summer months, and hopefully this infection will do the same.
John Edmonds?
I agree. I think we can't say with any accuracy where we'll be at the end of the summer. I don't think that the summer holiday, that warm weather is likely to reduce the transmission of this virus. It's spreading very effectively in lots of warm countries around the world right now, so I don't think that's going to be our salvation.
And Debbie Sridhar, finally to you.
Well, I'm going to give an optimistic scenario that we actually hopefully have an antiviral. We have a lot of repurposing drug trials, and so actually we can have a better treatment to offer individuals who are very ill.
Yeah, okay, so if I had to say in the New Zealand context, we will be through the winter. My point is that we've allowed people to come into the country and then wander unpoliced. Technically, there's a whole lot of people that were for non-violent drug offences and stuff. You could have released them out of the 10,000 prison population, and everyone that came into New Zealand from overseas, I'm afraid, unfortunately, they won the lotto and locked them up for 6 months in a prison cell on solitary confinement, and New Zealand would have escaped what we're currently going through. I understand why they didn't do that, but that is one option. The winter, yeah, it's going to be an interesting time. This antibody testing is the key to it, so that we can find out who has it, and there'll actually become parties where, like measles parties, where people decide they don't want to be afraid of it, go in, they take the risk, they have the virus, and then they get a pass mark on the other side, and then get back to work. There'll be those that don't want to do that, and they need to isolate for the rest of their lives. And I'm talking about, there's going to be probably a decade of having to stay away as it ricochets around the world. So you're going to have that chance. You either go in and get it and come right and then live your normal life, or you hide for the rest of it. And so those are the two decisions that the world is going to make, and it's going to be an interesting time.
Wonderful. Thank you very much, Reverend Dr.